Well, what's up? Good morning. Not Mañana.
No. Just
Buenos dias.
We'll leave it at good morning.
Buenos dias.
Yeah, we'll leave
todos,
it at good morning.
everybody.
Yes.
Come on in to the Rooted in Progress Stream Center. We hope you all are having a wonderful Thursday. I'm your girl, Deanne King. What's up, Terrence?
Hey, what's going on, everybody? Good morning, Deanne. How are you this Thursday morning?
You know, I can't lie. It's been a morning. Yeah. But like you said earlier, we're blessed.
Yes.
We are here. Yeah. And Rooted in Progress just always, it does it for me. You know what I mean?
Same here. Yeah.
Like it between our team, just everything about this platform,
Yes.
what we are doing, haters and all. We welcome you. We
yes,
love
please.
you. We appreciate
we need
you.
We need that feedback.
Y'all keep us going.
Yes. And you know one thing, Deanne, we what gets me going is, you know, every Thursday, just about every Thursday, we're here, we have a guest in studio or Zoom. We get it done.
Yeah.
But it's the work that leads up to this moment right here that just fuels the fire and just makes this more enjoyable, you know?
Yeah, absolutely. And we can't do it without y'all, for real.
Yes.
Haters included.
Yes.
So that means follow us and add us and like us, do all the things on YouTube, Spotify, Apple Podcasts. Our following just continues to grow. I love each and every one of y'all for supporting us. And today, I feel like we say this it's going to be a good one, but no, for real.
Yeah. It's like fine wine. It gets better and better each and every week.
Yeah, it's a topic, heavy in a sense, right? Yeah. But also very important. And it's one of those things, and you said this a little bit earlier, Terrence, it's something in some kind of way it has touched many people.
Yes.
I would say majority of folks, whether you know someone who has had it or whether you have been affected by it, or maybe you know somebody who knows somebody who knows somebody who may have been affected by it. But we're talking about breast cancer. And breast cancer is real. It's real for women. It's real for men. And it's one of those things where we have Breast Cancer Awareness Month. That is October. Shout out to all the pink. We had on pink yesterday now. I want to make that clear.
Yes.
To everybody, we had on pink yesterday, and we will continue to wear pink this month.
And I'm not going to lie, it's poor planning on my part. You know, I knew all week this was going to be our topic, so I should have just...
It's all
I'm
good.
a guy, I do wear pink.
Yeah,
yes,
it's all good.
Pink.
So we're diving into several things today. We're going to talk about literally what breast cancer is, prevention, the disparities, because black people are affected by cancer in a worse way than other nationalities, which is very unfortunate. We are going to hear phenomenal stories by two beautiful and incredible women who I am so proud to introduce. Bring them up, give them the claps, Terrence, because we have Miss Alicia Harris. She's a wife, a mom, an entrepreneur, and she is a breast cancer survivor herself. Alicia, thank you for being with us.
Yes.
Thank you for having me.
You excited?
Yes, very excited.
And we also have the talented, the successful, the incredible Dr. Nia Bailey. She is the CEO of the Bird Cancer Education and Advocacy Foundation. She's also a radiation therapist who, by the way, is at work. So if she has to save a life during this podcast, we understand, Dr. Nia.
Absolutely.
I appreciate you. Thank you for having me.
And you're hailing from Philly, right? She's in
You
Philly.
already know.
Yes.
Come on. I think you might be our first guest in Philly.
Hey, and not the last one.
And that's the joy about technology today is that we're just not rooted here in Tampa. We can be rooted all across the country, all across the world. So thank you, ladies, for joining us.
That was good, Terrence.
I know, right? Let's go. I got a whole chest full of that stuff. So.
Hey, I wanna go ahead and jump right into this conversation. I've been waiting to hear and be in the presence of Alicia and hear her story of survival, breast cancer, because what's also really unique and added layer to your story, your diagnosis came while you were pregnant.
Yeah.
So talk about that and the moment and how you found out. Just lay it all out for us.
Well, I found out when I was just going for like a routine checkup for my pregnancy. And one of the doctors, she said, do you want me to check your breasts? Which I'm glad that she checked. Mm-hmm. And she felt it and she said, well, I feel a little something there, but it might just be the milk ducts that's forming because you're pregnant. And she's like, but I'll give you a subscription. You can check it out and, you know, see what it is. And I kind of put it in the back of my head because I did have implants, and I was like, it's probably the implant. It probably isn't, or probably pregnancy. And I really was, because they checked it before, my breast implants, and they said that there was something there, but it was non-cancerous. So I kind of thought it was that. So I really didn't think it would be cancer.
Yeah.
So, but I did go follow through, and I got a sonogram. And after the sonogram, they scheduled me for a biopsy. And then when I got the biopsy, I knew that something could be wrong because you're pregnant and they're telling you to get a biopsy. So after that, I found out that I was diagnosed with breast cancer, and I was about 13, 14 weeks pregnant.
Wow.
And yeah, that was a tough conversation, especially with my husband. This was his first kid. And when we heard that, we were just devastated because I was just thinking, like, am I going to be there, you know, be able to watch her grow if I have her? You know, all those thoughts come into your mind with that big news.
Yeah. That's something. So you said it was about 13 weeks.
Yeah.
13 weeks. And when did you find out that you were pregnant?
About 9, I was like 8 weeks.
Wow.
9 weeks. Yeah.
And so the excitement of hearing we're pregnant, we're getting ready to have a kid, like it's a blessing. It's a joyous occasion. And then that quickly shifted. So what were your next steps after you found out that news, aside from mentally grasping that you just received that news? What was next for y'all?
So what was next is trying to find the best care. So we went and saw a couple doctors and got a couple opinions. One of the doctors told us, you're going to hear a lot of people that might recommend you to, get an abortion so that you can continue treatment. Luckily, we found the first doctor, we did not want to go with their treatment plan, so we got a second opinion. And with that second opinion, they laid out a plan that was perfect for us. And they had someone who had just got pregnant with cancer that was a couple of months ahead of me that they dealt with. So I felt more secure and safe, like following their procedure with that doctor.
Wow. I would have never, hearing cancer or hearing a cancer diagnosis in a pregnant woman, I would have never thought it was possible. I would have thought, as scary and as dark as it sounds, someone's not going to make it.
Yes.
Someone's not going to make it. And who and how? Like who, how, what, where, why? Like all of the questions, which I'm sure you had. So when and what did that process look like for you, going through treatment while also being pregnant?
Yeah, so they said that we had to do surgery. We did surgery like a couple weeks after I found out. And of course, you're doing open surgery while you're pregnant. So that was risky, but we got through that. And then they recommended that we started chemo while pregnant, which I was like, you can do that? I was like,
yeah.
They tell you don't take Tylenol, don't drink wine, but then they're telling me to take chemo while I'm pregnant. Wow. So that was a big decision. They were like, well, you can think about it. You can talk to your husband and you guys can make a decision. And we just weighed out all the options and we said, well, we're going to do it because I want to fight and be there for my baby and to watch and see her grow and my other 2 kids because I have 2 sons.
Wow.
Now, if you had mentioned it already, how old were you at the time?
I was 37.
I'm 37 years old, being diagnosed with breast cancer. I mean, did you ask that question, going back to what Deanne said, did you ask that question of why me?
Yes. Because
why and how, really? Yeah,
why and how? Because it doesn't really run in my family. Nobody had breast cancer. So it is not something that I expected or even thought about. So at that time I was like, why me? And why now, especially while I'm pregnant? And I just got married. We got married. And then 3 months after that, I got pregnant. And then a couple months after that, I found out that I had breast cancer.
My God. Wow. I want to bring in Dr. Nia, because when we hear going through chemo while pregnant, and the radiation aspect of all of that. Can you speak to that from an expertise level on how it's even possible for a woman who is pregnant to even be able to go through and get chemo?
Absolutely. And I have to say, I was even honest because becoming a radiation therapist, that's the first thing that they say. I've had plenty of patients who were pregnant and, to Alicia's point, needed to have an abortion prior to and then receive treatment. So that was even news to me. And Alicia will tell you, that's not common at all. Not a lot of healthcare professionals even know that's even possible. So it was a blessing to have met her and to hear her story. But going through radiation, you can't be pregnant, at least not now, and have treatment. So she was very closely monitored. You have to be closely monitored to go through chemotherapy and the type of chemotherapy so that you're able to lower your chances of recurrence and stop the progression of the cancer, but then also keep the health of the child.
What are the risks?
Oh my gosh, so many risks. I mean, chemotherapy has so many risks, but not doing the chemotherapy is risk. The risk can be toxicity to your heart because it's throughout. Chemotherapy is systemic. It affects everything in your body. So it can affect everything. So you can imagine that while Alicia is going through that, she may be thinking, and anybody that's listening to this wonderful podcast, that it can affect my child, but it didn't. So it's the type of chemotherapy that you're getting that it's saving Alicia's life, but also not touching Journey's, which is saving her life as well.
Wow. And that is what's even more remarkable. Alicia, did you have any concerns about the effects of what you were going through and what that effect could be on your child?
Yes,
and on Journey?
I did have concerns, and I asked a lot of questions, and I advocated, and I wanted to make sure I knew everything before we decided to do that. And they said that if we started on the last trimester, that the baby will be fully developed. So that was the best time to do chemo. So that the only risk can be that the baby just might be smaller in size, and we might just have to induce early, but the baby's everything else should be developed, and we shouldn't have to worry about that. So thankfully, when she was born, she was healthy, and she was a little smaller, but she still was, she was about 5 pounds.
Yeah.
And they said that she might be a little slower in like growing just because she also was born a little bit early, but actually she started walking at 7 months. So
well, come on, Journey, girl. She said, I got places
Journey's
to go.
like, I just been through it all. Like, this is nothing for me.
I love to hear that. I love to hear that. I'm curious, when we look at the disparities within these diagnoses and breast cancer facing Black women, Dr. Nia, did it make it even more difficult for a patient like Alicia because she is a Black woman receiving this kind of diagnosis during the time that she did?
Absolutely. Black women, to your point, get aggressive cancer. And by the time that they find out, it has metastasized, it has spread. And talking about the guidelines, so the task force first said that you have to start getting mammograms at the age of 50. They have now reduced that age to 40. But typically for Black and brown women, we typically get the diagnosis prior to 40. So it is very astounding, but not shocking, that unfortunately Alicia had the breast cancer diagnosis before the age of 40. That's why we always tell people, especially Black and brown women and men, to know their family cancer history and then to also know their body, because to take that information to their provider so we can get those steps going. Depending on your family cancer history and how you feel your body and what your body is producing and showing you, you can get screened at an earlier age. And the hope is that you can get the chance of either catching the cancer early or preventing the cancer.
Go ahead, Terrence.
So you said men. Let's dive into
Welcome
that.
to the chat.
Yo, so what we're saying is that this is not just a woman's disease. This is a disease that affects men as well. Given the fact that I'm the only male on this in this panel right here, or on this panel here. Talk about that. Like, should I have some concerns? I'm 47 years old. Should I have had a mammogram by now, or should I go get one as soon as this podcast is over with? What? Tell me, lead me, guide
absolutely.
me.
Yeah. You need to absolutely
be.
You absolutely need to know how to feel your breast. Men have breast tissue, so you need to know how to feel it. You need to feel under your axilla, under your arm. You need to know your family cancer history. Let me ask you, do you have cancer in your family?
I do, yes.
Okay, so you need to take that to your doctor and say, hey, doctor, this is who has cancer in my family. They will then put that into what's called a risk calculator, and that will determine your chance of getting breast cancer. Depending on that percentage, you will then start getting screened now. And then depend on that, you need to talk to a genetic counselor. The genetic counselor will get you genetic testing, and that will determine if you have a predisposition of getting certain types of cancer, not only breast, but prostate, and lung. And that information is very important. I have a friend who was diagnosed at 28 years old, and her son, when he turns 18, he has to get a mammogram and an ultrasound. So it's very important. Men, though it's rare, it's about 1 in 800 men that get diagnosed with breast cancer. It can happen. My uncle passed away of breast cancer. So he was a Black man from South Carolina, and you couldn't tell them nothing. He didn't think he could.
I mean, say that again. You said your uncle passed away of breast cancer, and 1 in 800
Black
men.
Man.
Wow. 1 in 800 men. We may think that percentage is huge. It's really not. It's really not. That is a very small chance, a very small number, and a very large chance that men, we're walking around here with the cancer trait in our breast.
Yeah.
Correct?
Yeah, it's very important. Yes, just to know. Even women are 1 in 8. So we really need to know family cancer. And that's why when we talk about disparities, like, I feel like the Black and brown community doesn't know their family cancer history. Like I said, my family comes from the South. So Alicia, you might even know this too. I don't know if it's in the Caribbean community, but it's like, I don't know how they passed, or they passed of bad blood, or it's just something. But that information is so vital because depending on how they passed and when they passed and what they passed from, that can help you get screened, and hopefully, and it will save your life.
So for people like me, like Journey, for example, Alicia's daughter, or even me. So my maternal grandmother actually passed from breast cancer, and she passed when my mom was really young. My mom was all of 10 years old. And so I never got to meet her. However, I do thankfully know that is a part of my history. So I know I'm one of those that has to get the test done early and things like that. What's the suggestion as far as age for anyone who may have had family members who had breast cancer, especially that close? So I mentioned myself and I mentioned Journey because for Journey, it was her mother. For me, it was my maternal grandmother. So we're like right there. What's your advice as far as age and getting screened?
I don't think I would ever give a number because the youngest patient that I've seen or heard about just in the community was 18 years old, and she had breast cancer. So I would always recommend, as soon as you get your cycle, or even before then, know your body, feel your body, know your family cancer history. And then, say you start your cycle at 13, you want to start feeling what your chest feels like when you're on your cycle, when you're off your cycle. You want to feel your chest in the shower. You want to feel it when you're laying down. You want to look in the mirror and look how your chest is. Your chest, your breasts are going to be sisters, not twins. So of course there's going to be some differences, but you want to really look at that. And you also want to have a patient-provider relationship. So once you establish that with yourself, establish that with your provider so that there can be a plan in place of when you need to start getting mammograms or ultrasounds or breast MRIs. So it's hard for me to give an age because there's such thing as pediatric cancer. So I throw age out the window. You can unfortunately get cancer at any age. So I would just say, know your body, establish that relationship so there can be a plan in place when you can get screened.
And definitely advocate for yourself because they're not going to just let you get a breast exam at any age. You got to really say, like, I feel something, and stick with it and stick with your instincts and continue to push for and advocate for yourself is definitely important.
100%. Yeah.
And Alicia, you brought up something, and I hope you're comfortable talking about it, but the thing about having a breast augmentation, and having implants, and so I've heard multiple things like, oh, that could help, it could hurt. Is it harder to detect? Did you talk about that, or what kind of role did implants play in like your journey?
Well, of course, a lot of people are going to think, well, maybe you got the cancer because of the breast implant.
Mm-hmm.
So that was kind of what I was thinking. Did this cause this? Like, where did this come from? Because it doesn't run in my family. Maybe because I had breast implants that played a part in it. But the doctors informed me that breast implants don't have anything to do with that. But it does make it harder sometimes to be able to feel your breast, depending on what type of implants you got, whether you got saline or silicone. And sometimes you just don't, feel your breast as much when you have an implant in there, or it just might be hiding behind it. So you definitely got to, check yourself a little bit more and just be more aware about it. And then when you get a mammogram, sometimes it's harder for the mammograms when you do have an implant. So.
That's good. And as soon as you said that, it made me think about that, because I have heard, I feel like what could be misconceptions or chatter around the implants and the relationship that could have for folks who actually have them. Dr. Nia, when we're looking at these statistics, and I know Terrence actually has some, and I kind of just want to get y'all's reaction on them. So it's the second most common cancer in women in the United States. Now, Black women are more likely to die from breast cancer than any other race or ethnic group. My question is why? Why
I don't think anyone knows. I don't think anyone knows. Some people will say it's access to care.
Yeah.
Some people will say, as Black women, we power through until we can't power through anymore. And by that time, the cancer has, advanced. Yeah. Some people will say racism and biases. So you go to your doctor, and like Alicia says, you try to advocate for yourself, and you get pushed away. You're too young for breast cancer, or you don't have a family cancer history. And let me just say this, while it's important to know your family cancer history, and I will always say that, breast cancer and cancer only make up about 10% of breast cancer. So you don't have to have a family cancer history to get breast cancer in particular, as we're talking. So there's so many components. It can be the diet that we eat. I mentioned my family's from South Carolina. They're still eating pig feet, no judgment, but that's not
South Carolina, lima beans.
Girl, you okay? You saying it. Or our environment. I come from a family, like I said, in inner East South Carolina, and you want to talk about redlining. So the Black people were over here. Everybody was over here, and they dumped the toxins on that side. So when my family drank from the well, they drank toxins, and so then they got cancer. So there's so many different components as to why we get the business. I know there's a doctor by the name of Lisa Newman, and she's going back to Africa and trying to figure out those who are Nigerian, Ethiopian, what's that chance of us getting breast cancer? But the issue with that is we call ourselves African American, so we don't know where we come from. Yeah. So if we did know where we came from, that may be easier to determine our chances of getting breast cancer.
Wow, that's powerful there, and I brought that up because I'll call him out. We have a comment on our Facebook page that says, "Cancer doesn't care what color you are." Shaking my head. And I want to make this very clear, and I feel like we do this in a lot of our episodes. This is why I always shout out the haters. It's one of those things where nobody is saying that breast cancer is targeting Black people more than it's targeting any other culture. The problem here is the statistics show that breast cancer is having a disproportionate effect on African Americans and on people of color than it is in other communities. And that's the problem. Yes. That's what we're discussing.
And that's the purpose of Rooted in Progress.
Correct. And so when we're looking at these issues, it's not because we support it. It's not because because we want it to be that way. It's just the facts are the facts. And so when we're looking at these issues and we're seeing the impact on, especially on Black and brown communities, we ask ourselves, what can we do?
Yes.
Mm-hmm.
And I bring this up because both of you all have incredible foundations, and I want to talk about those where we're talking about advocacy. You all are talking about prevention, and I think those are great steps when you're looking at these disproportionate effects on breast cancer in Black and brown communities, and you have people like yourselves who are doing great work to hopefully combat that. So I'm of course going to let both of you all share the work that you all are doing across our country, because you are rooted in Philly. So Alicia, tell us about the work with your foundation and what you're doing here in Tampa.
So I started my nonprofit, of course, because of what I went through personally. And I realized there was a lack of resources and support for women that are mothers and also pregnant while battling cancer. And actually, I got dropped by my OB because I was too high risk. And
My goodness.
I literally went to every single doctor in Tampa.
No.
Every single doctor. Like, I tried every single one, and not one will take me because they said I was too high risk. And I guess nobody wanted the liability. Nobody wanted to care for someone that was pregnant with cancer. So I literally had to have a friend of mine go on a Facebook group and say, my friend needs a doctor. She needs somebody who can care for her baby while she is going through this. So I had to go to a doctor in St. Pete, and I had to deliver the baby in St. Pete. So that was one of the things that I saw, that along with all of the doctors that I went to and some of the recommendations, and some of them really just didn't know that was possible or that you could do treatment. So I said, I want to start a nonprofit to be able to help these mothers and help women that are battling cancer either while pregnant or have small children. And so I started Journey for Two, which obviously I got the name from my daughter.
Beautiful.
I said Journey so much while
Look
I was
at
pregnant.
Representative Castor. I just noticed that picture.
Yeah, she chose me actually as the one that she wanted to represent for the congressional softball game in Washington. And she invited me to Washington to join her. So yeah, that was great.
That is amazing. Your nonprofit also has a new event where you are doing exactly what you were talking about, combating these disparities and working and doing the prevention work, right? So tell us about the event that folks in our community can attend.
Yeah, we're having an event. It's going to be October 12th. It's going to be from 9 to 2 p.m. It's going to be at Love First Christian Center in Riverview. And we're giving free breast exams and routine health screenings. And there's going to also be panelists, there's going to be medical professionals, and there are going to be keynote speakers, food vendors. It's going to be a great event, and it's completely free. You just have to register, but everything is free. There is no insurance needed. You can come and just get checked out. Nothing else is needed. And it's going to be a great event for both men and women can come.
Yeah, check save your life. So it's a very important event, October 12th. I'm coming. So y'all come join me. And I'm gonna get checked because I mean it's serious. You know, it's one of those things where we can laugh, we could joke about it, of course, and have a good time. But being able to have organizations and people in our community like Alicia who are providing opportunities like this, like there's no excuse.
None whatsoever. And again, you just heard that men do suffer from this condition, from this disease as well. So men, it's open and free for you as well.
Yeah.
Please come represent.
Make sure you all tune in and go to that event. Dr. Nia, I want to hear more about your foundation. You have the Bird Cancer Education and Advocacy Foundation. Talk about the work that you're doing with that.
Absolutely. We call ourselves the connectors. We connect patients who want to prevent, treat, survive cancer, and everything in between. We talk about integrative wellness, counseling, and that's how we found Alicia and her powerful mission. And that's what we do. We connect. I just really want to emphasize what Alicia does because, like I said, in my field, there was a time when we would tell women to get an abortion. And she is literally in real time saving women's lives. You don't have to choose between yourself and your child. You both can live, you both can survive. So we are doing that. I connected with Alicia, we connected with Journey for Two, and all we are doing is get the information out there so we can save lives.
That's important.
Yeah.
That's important. So no matter where you are, if people want to tap in, and again, this reaches the masses. So no matter where you are, particularly any of our listeners that are actually out there in the Philadelphia area, reach out.
Yes.
Reach out, engage, get involved. Do you have any events going on soon, Dr. Nia?
Girl, who knows?
I'm just blessed to be here.
So Dr. Nia,
we
real
have
quick.
one in 8. Oh, okay.
I'm sorry. How can our viewers and listeners get a chance to follow you as well as stay tuned to whatever events that you may have coming up in the near future?
Absolutely. We're under everything birdcancerfoundation.org. That's our website, Instagram, social media, Bird Cancer Foundation, because that name was too long to post.
And that's
And
B-Y.
then you can also, the Y.
That's B-Y-R-D.
B-Y-R-D. And I pay homage to my family because that's my family's name. So Bird Cancer Foundation. I just want to emphasize also how to prevent. So there's this acronym by the name of Brenda of how to prevent breast cancer. So it doesn't mean it eliminates it because what I'm about to say first, it didn't eliminate for my beautiful friend Alicia. But B is for breastfeed. You want to breastfeed for about a year. R is you want to reduce your sugary intake and alcohol intake. So I know, listen, I love me some vodka and cranberry, but it's not good to drink it all the time. E is exercise. You want to exercise for about 30 minutes a day. N, you want to eat nutritious food. So you want your plate to be colorful. D is do not smoke, vape, hookah, because there was also a time where I would hookah and post on the gram all the time. So don't do that. And then A is achieve a healthy body. Girl, okay. A is achieve a healthy body weight. So if you remember that acronym, Brenda, it reduces your risk. It does not eliminate, but I do want to emphasize it reduces the risk of getting any type of cancer, but in particular breast cancer.
Now, Lisa, my question is, with that acronym, how much of each one of those letters were you abiding by before you're diagnosed? I mean, I know nobody's perfect, and
Yeah, definitely not all of them because I like sweets.
Of Brenda, I'm at right about now. I'm maybe
me too. I'm like,
the Brenda. We're off. Cut it out.
Like I exercised, and at that time I was exercising. I was drinking just very occasionally. And I don't smoke anything. But I do like sweets. So I am a sweet girl. I love candy. And I'm worse than my kids. I'd be stealing their candy. I'm like,
So I guess the purpose of that question I asked was that, guys, listen, if you're listening in, and I know no one is going to follow or has followed that entire acronym. This is important. This is why it's important to get checked. You can live a healthy, perfect life, and nobody's perfect out there. Again, I'm 47 years old. I go to the gym. I take my vitamins, as we know from our meeting.
He does.
It's a whole nother story.
He stopped a meeting to take vitamins.
I'm like,
he did.
So, I mean, to me, health is a priority, but I know that it's not a prevention for me to not be diagnosed with something. So therefore, at least what I'm saying is that I'm doing my best, but what God has for me is for me. And so please go get checked. Be your own advocate. Go to the doctor regularly, get your physical checkups.
Don't be scared.
Don't be scared,
of
and we all talk about this insurance and all this stuff. And I know there's a whole political view behind all that stuff. So without diving too deep into that, be your own advocate. Listen to your body for sure. 100%.
Being your own advocate is huge. It is huge. And even representation within the medical field, like, my goodness, that's a struggle, because you feel like at least that person can advocate for me because they experience or may go through some of the things that I go through. But then they're few, far, and in between. Yeah. That's a whole nother problem, whole nother situation, whole nother podcast y'all might be back for. But no, I appreciate you all. Before we go, I do want to talk about the Journey for Two event that is happening again on October 12th. One more time for my folks here in Tampa Bay, 9 a.m. to 2 p.m. Go out and get checked, y'all. Love First Christian Center in the View down in Riverview, doing some free breast exams and routine health screenings. And Alicia, you were telling me it's the BEXA.
Yes.
So, and that was really
cool.
So
it's not a mammogram. It is a BEXA, which is like, it's almost like spa-like. You lay down in the bed and it's like a handheld device and it's able to detect and let you know right then and there if they find a tumor. So it's very painless.
Period, Pooh. Go to the spa October 12th at Love First Christian Center in Riverview.
Yes,
that's another way to put it.
Yes, and no insurance needed. Just come and get checked.
I appreciate the both of you all. More importantly, I appreciate the work that you all are doing in our community, in our country. Saving lives is important. It is Breast Cancer Awareness Month, y'all. Make sure you go out and get checked at least some point, hopefully this month, and take care of yourselves. Yes. Dr. Nia, you got to come to Tampa. We got to come down to Tampa. This will be your one time you can have your vodka and cranberry. Just the one time.
Yes.
We'll get you some food. We'll get you some food. We'll get you a little drink and host you here in Tampa. We appreciate you hanging with us this morning and all of your insight. You are amazing.
Yes.
Thank you. I really appreciate it.
Yes,
of course. No problem. Alicia, we appreciate you and the strength of a woman that you are. Yeah. Oh, my goodness. And I can only imagine how proud Journey is. Is she, so she's 2, right?
Yeah, she's 2.
So she's not aware yet.
Oh, yeah.
She is?
She's a little aware because she says Journey for 2. And we make baskets and we ship them to moms that are battling cancer. And she helps me pack the baskets. She goes with me to UPS to kind of do it. Like, she's all about it.
What a perfect
so
name,
she knows how much of a blessing she is.
Oh, yeah.
I love that. All right. Follow Journey for 2 as well. Y'all make sure y'all support Alicia, that event again, October 12th. All right, Terrence, you coming with me?
Unfortunately, I will be out of town.
That's crazy work.
But I'm taking all this information very serious. I think my next physical, I'm going to request a mammogram. So,
there you go.
Yeah.
Or some kind of check.
Or some kind of check or something like that. So
Good
I'll
for
be
you.
standing in the mirror with my arm up, doing what I need to do to get that checked out. So
this is the definition of rooted in progress, affecting our very own Terrence Middlebrooks. Come on, everybody. Rooted in progress gets results. Hey, we're here every Thursday. I know we did this a little early today, but we're typically live every Thursday, 11 a.m. Make sure y'all join us. We're having some really important conversations, changing lives here on Rooted in Progress. We're live on the WFLA app, WFLA Facebook page, and WFLA.com. And then, of course, like, follow, and subscribe on Spotify, Apple Podcasts, and YouTube.
Yes. And I just want to add again, for those that were not listening earlier, like we basically,
if you ain't hear me before, you're going to hear me now.
Yeah, you're going to hear me now. So we rely on you to like, share, like Deanne just mentioned, but we also would love your feedback. We also would love your story ideas. So,
not you, Marcia. Was that
whoever
the name?
Marcia, yes. So anyway, if you got any great stories that will allow us to be rooted in progress and continue this wonderful podcast, we ask you to send them in.
Let us know, everybody. Hey, y'all have an incredible day, no matter what day you're listening to this podcast, and stay rooted.
Stay rooted, guys.